that's what psychosocial health means, is treating the whole person. It's their emotions, their social interactions, their career, their relationships, communication, and just and financial. So that's what psychosocial health means in the cancer continuum. And then this is one of my mentors who has been working, or she worked in oncology for, I believe it was about 50 years. She recently passed away, but this is really, that statement is how we view every person, that we take a view of every person is unique and you deal with it differently, and we need to be flexible and look at each person as a unique individual and support them from wherever they're at. And I think that's sometimes hard as we talk about the patient and family experiences. Sometimes we do cookie cutter care, and in supportive oncology, our view is to meet a person where they're at and go from there. And that's what we really work hard to do. My presentation is really on the common psychosocial issues affecting people who have been diagnosed with colorectal cancer. And so if you could see that the first and the most important to help a person go through the cancer experience is really to touch on the emotional well-being of a person. And, you know, like I said earlier, cancer affects your physical health, of course, but it also brings up a wide range of feelings that you're probably not used to dealing with. And it can make existing feelings seem more intense. So perhaps you had some anxiety before a cancer diagnosis. Sometimes it can elevate after a cancer diagnosis. They may change daily, hourly, or even minute to minute after a diagnosis and throughout treatment and the end of treatment. And I think hopefully Carlin talked a little bit about after treatment. If you're not in active treatment right now, there's a phase of healing that needs to happen in survivorship that not a lot of people talk about. So I want to touch on that in regards to your emotional well-being. Any questions about that? Okay. So some of the common emotions and concerns. There's sadness, there's fear, anxiety, depression. Have any of you heard of post-traumatic stress disorder?
Yes.
Yes.
So the common psychological effect of a cancer diagnosis is feelings of sadness, fear, anxiety, depression, post-traumatic stress. And that also carries over to our loved ones and our caregivers, that's called secondary trauma. And those are the things that, depending on where you guys are at and what cancer centers that you got treated at, there's varying levels of support. What I've learned, you know, through my experience in talking with different people and their families is everyone is different, right? Go back to that quote from Jimmy Holland. Some people like groups, some people like one-on-one, some people don't want any, you know, specialists or psychologists or clinical social worker talking to them. So it just depends on the person and what they're open to. I used to run a lot of support groups, and we're starting another young adult one up soon. But yeah, some people would come to me and say, this is not for me. I'm stage 4 and I don't relate to all these newly diagnosed people with stage 1. And so then we would just talk about what the different resources are for them to make sure that they feel heard and that they get the support they need. But yeah, I agree. Everyone's different. Groups, one-on-one, got to find the right fit. And I'll tell you in my experience of, you know, even a person diagnosed with stage 1 to diagnosed with stage 4, continuous treatment for the rest of their life or been cured, have the same emotional response to a cancer diagnosis, and it's that list. And I think it's hard for patients to turn the attention on themselves and say, this is important for me, and not try to compare to somebody else. And I think that that is kind of also adds to the survivor's guilt and the social isolation, to know that you're just as important, and no matter what your stage is, your experience is yours. And I think, um, it's important to recognize, and try not to compare to others, um, tends to be more helpful if you can, but I can see it's a very delicate balance. I've had many people say, well, I can't say anything because I'm only diagnosed at stage 2 and they're diagnosed at stage 4. This person had surgery and I didn't have surgery. And it's just not it ends up not being super productive. It's great to have that awareness of being sensitive to other people, but it also at times can minimize your own self if you don't allow yourself to have those feelings. Does that make sense? All right, so I'm going to move on to some of the social, career, and relationship issues. As we talked about, after a cancer diagnosis, cancer affects the whole person, just not the medical part. And with colorectal cancer, there's a lot of stuff that goes on there that not a lot of people want to talk about. Or you can only talk about it with your doctor or your loved one or partner or husband or wife, but you don't get to share. And I think, as I've put down some of these bullet points, is due to some of the social stigma of just the diagnosis alone of colorectal cancer, many people do not feel a sense of acceptance. And what I said, and these words that I put on the screen come directly from my patients, where they're sitting in my office and they're saying, this isn't the pretty cancer. This is not the pink cancer. This is not the pretty cancer. And I can't talk about it. And that's why they're there, because they feel isolated. Does that sound, have you guys gone through that when we're talking about social, being out in the community, and your career, sitting at your jobs, and your relationships, if you're single, if you're not single and you want to date, and all those, and your friendships, and if people aren't comfortable talking about what you're actually going through, not just sugarcoating, it could be very isolating emotionally and socially. And a lot of people stay home because they don't want to go out in the community, say they have an ostomy and they're new to it, or they're having bowel problems or pain, that a lot of people can stay home and a lot of people can not talk about it, and it makes them feel very isolated and depressed. Find those people that can talk about the poop and the pain, and that aren't going to shy away. It isn't a pretty conversation. And for some people, if they're not in active treatment, or if they didn't get chemotherapy and they're not, and I know some of you have, is if you don't have outward physical signs that people can see, people tend to ignore. And it's not intentional, but it is hard to break that wall down. Many of my patients and their family members, especially post-treatment, when they looked good, they had their makeup on or their hair back, everyone said, hey, you look great, and stopped asking how they're doing. And inside, they were still healing and still struggling. Treatments nowadays are different than they were 10 years ago. And there are advancements that you might not feel the effects as strongly. The outcomes have improved. And so if people from your past or family have passed away from the past, the cancer experience is different now. And that's really hard for family members and friends to understand, that people can live with cancer for 20, 30 years. And for people diagnosed with cancer, is how do you live in the world knowing that you can, everyone has a perception that cancer is I don't know if it's quote unquote death sentence. That's no longer the case. And it's how do we live healthy and happy past cancer. And that's what we're studying. That's where we're seeing our outcomes now, that that we're not just looking at the chemotherapies, but we're also looking at supportive care services and therapies that are helping people live longer and happier and healthier. And I think friends and family, from what in my experience, don't know how to cope with that. And it takes a conversation, and that's on another slide of mine, is having this open dialogue with people and being really honest with them. Because nowadays we do have people that used to have 18 months life expectancy living 18 years, and that is, not everyone knows how to cope with that, even the person diagnosed. Yeah, there's friendships can change things. I have found that some people that you never thought were going to be your friends become your friends. Some people disappear that you never thought would disappear. Sometimes relationships end, and then people come forward and with that you never expect. So yeah, relationship changes, communication changes are common. Something that also, for people that have been in relationships, the common thought is, after a cancer diagnosis, that loving relationships would get closer because this is a life-threatening disease and we got to love each other as strongly as possible. But actually the opposite can happen, and that it's really scary for people because they never expected your loving partner to actually be more distant or communication to decrease. It just is a conflictual thought, is like, oh God, no, we're supposed to love each other more. But due to many different factors, is that in relationships, more arguments can happen, less communication can happen, feelings of loneliness can happen on both sides. And that's something that I think surprises people and can impact them very much so. And so that's something that I'll talk about at the end of what you can do about that. Another thing is, in the work setting, if people need accommodations after cancer treatment, and maybe they're not sanctioned by the ADA if you don't have a disability, but you still need some flexibility in your work, that also can be challenging as you go back to work. And it's hard. I'll tell you, this isn't easy, and it takes practice. But it is really helpful when you say to your spouse or your partner, your friend or your best friend is, I know you think you're helping me. I actually just need you to listen. And I know it's unusual for me to ask for help, and you can count on me usually all the time. I just need a moment to have you listen to me. Can you do that for me?
Right.
It's hard. It's a pride thing as well, especially if you're very proud of being strong and being independent, to allow people to help and explain it that you actually need their help. Because I think a lot of people depend on you or depend on those strong people to be that strong person, and they're not quite sure what to do. But if you directly say to them, I know I've been really strong in the past, and sometimes I do good, but sometimes I'm having a hard day. And today I had a hard day. Can you listen? And you'll stumble over it, and it'll be awkward. But the more you practice that, the better it will be easier for you to do that. And you will find your friends and family and coworkers opening up, because now they actually can help you. Like, if you give them specific, this is what I really need right now, can you help me with this? And give them an opportunity to decide if they can or can't. It's hard.
No, you're right.
Don't get me wrong, but try practicing it. And then just something to end this part of the social career and relationships is, depending on where you are, and for people that, like Brian, you're saying you're ending treatment soon, there's something that happens psychologically, and I don't know if other people notice this, is at the end of the treatment, and maybe Carlin talked about it, at the end of treatment, there's a sense of an emotional feeling, there's a sense of a drop off, where throughout the duration of your treatment, you had nurses and doctors and social workers and friends and family, everybody helping or talking, or you're in treatment and you're going. And then once you complete treatment, some of that starts to fade away. And although people are very excited to end treatment, they feel lonely and they're surprised that they're feeling this sense of loss, even though they don't want to go back to the cancer center. I've had many patients come back to me and go, Marianne, or first when they end, they're like, can't wait not to see you. And I don't take it personal. And then, a month later they call me and they say, I'm having a hard time. I'm really missing, that support. Can I come back and see you and talk to you about it? And so just something for you guys to be aware of as you move through the world, wherever you are in treatment, is that it ebbs and flows. You're connected to your social groups, connected to your healthcare teams, your relationships. There's ebbs and flows of feeling connected, and just keep that in mind, and don't label yourself as something wrong with you. It's just the psychological effects that we see after people get diagnosed with cancer, and it's just something you wouldn't expect, and just something I wanted to let you guys know about. So real quickly, and I'm sure you guys can teach this, that after going through colorectal cancer and a cancer diagnosis, self-image can be affected, sexual health and intimacy can be affected, and that's very normal. The thing in this topic alone is it's not talked a lot about with the doctors, and we're working really hard to have our physicians and our healthcare providers talk more about this. But this is something that it's a private conversation, but we want to encourage patients and families and relationships, our loving relationships, to talk about these things, because this does get impacted. And then something at the end, and not everybody might not hear about it, but there's something called oncology rehab that has been coming in the last 5 to 10 years. And specifically within the last 5, there's been a momentum of physical therapists, occupational therapists, and speech therapists, depending on diagnosis, that can help you in regards to your sexual health and your continence, and they are the specialists in the field, and they're not general practitioners. They're trained in sexual dysfunction after a cancer diagnosis, or if a person has an ostomy, or there's incontinence problems or impotence problems. So consider looking in your local community or reaching out to the national organizations to see if there's oncology trained rehab therapists in your area. And then, lastly, with regards to self-image, sexual health is, like we've talked, is the common feelings that can happen is a person's self-image gets impacted and how they look at themselves. There's a loss of self-confidence, fear and embarrassment of being seen naked, a loss of libido, which is extremely common across the cancer continuum, no matter the cancer diagnosis. But with colorectal cancer, there is more layers that some people have that we need to destigmatize or normalize, to make sure that everybody's sexual health is still part of their life. If that's what they want, that should happen. And then when I was talking about communication skills, this is a very sensitive subject. So communication with your partner or dating tends to go down, and a lot of people don't know how to navigate it. So my tools, as we're going to the next slide, this is ending to give you guys some tools to move forward, is to be honest with your healthcare provider. If they don't know, they can't help. And as much as we want our healthcare providers to think of everything and to talk to you about every topic, they might not feel comfortable, they might forget, but you coming in with a list of questions saying, I want to talk about this. If they can't talk to you, ask for a referral. Another tool is really to consider counseling. And you know what? I've had to really normalize that in my 15 years of counseling people with cancer, because they come to me and they say, I'm not crazy, Marianne, I'm not crazy. And it's not about crazy. It's about just having normal emotions around a cancer diagnosis. Generalized anxiety, generalized depression, situational anxiety is so common. But a lot of people feel like something's weird about them, that they're not coping right. And so I would just encourage you to consider that you're just having normal emotions around what you're going through and not look at it as a weakness. And so please consider reaching out to, there's a lot of oncology trained social workers out there and psychologists. So I would, even if you have to Google it in your area, because I don't know all your guys' areas, but look to those national organizations to find those resources and attempt to go find some emotional support. There's also those matching programs that I was telling you about, like Immerman Angels. And then sometimes in local communities, they have peer-to-peer support. So I'd look into that. Educational series like we're doing right now, I highly encourage you to look on different websites. I will put in a plug for always look for validated, researched websites. Don't go to the kooky ones that just scare the crud out of you. Go to our national organizations, National Cancer Institute, the American Cancer Society. Go to those ones. Don't go to just some random one that you don't know where it's coming from, because they give a lot of scary information. Again, oncology rehab, you can Google that, and sometimes you say oncology trained physical therapist, and that can come up. Consider exercise. That is one thing, even though if you're tired, if you have impairments, think about how you can get just a little bit of exercise, because actually exercise can improve your mood and your coping. It's a chemical response. If you get your body moving, your brain and your mood is going to improve. If you have any intimacy and sexual dysfunction because of your cancer diagnosis, I would consider seeking an expert. In a lot of major cancer centers and possibly have those. So look for those. And then talk to your friends and families that you trust. Like we were talking earlier, it might be awkward at first because of your role that you've had for 50 years, 20 years, however old you are. But reaching out, sometimes friends and family just need to know exactly what you need. And then look for local and national support groups. They're there to help you. I would suggest at least trying one time, because I think some people, I don't need a support group. There's going to be people just crying and depressed. My support groups, we laugh. You know, we have fun. We think of good things. There are tears at times, but there's also hope and comedy and a sense of community. So consider that as well. And then I just listed a whole bunch of resources that I have for you guys, and I listed what they provide. And I think Sharon said she'll give the slides to you guys so you have those.
Thank you so much, Marianne.